What can you do at home to get rid of stubborn and sticky phlegm in your throat and in your lungs? In this video, I will teach you easy but effective breathing and coughing technique that will get rid of the sticky phlegm in your lung and in your throat. Stay with me until the end because I will also teach you position of comfort, or the position which you need to do if you have difficulty with breathing. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you would surely benefit from. The techniques that you will learn today, you can apply it no matter what the cause of the phlegm. May it be due to normal colds, may it be due to pneumonia, asthma, and even COPD. It is best paired with the medicines that your doctor have also given you. Mucus is a thick secretion that is produced by your respiratory system. The function supposedly is to trap any foreign particles that enters into your airways. However, excessive mucus or phlegm, it's not also good for you because it can affect your ability to breathe and can even affect your oxygen level. That's why this correct breathing and coughing technique, it will greatly help you. First, let's do diaphragmatic breathing. With diaphragmatic breathing, you're going to place one hand in your chest and your other hand in your belly. You're going to take deep and slow breath, or inhale slowly through your nose and then you exhale through your mouth. With this, to monitor if you're doing this well, you need to feel a slight elevation in your abdomen or in your tummy when you inhale, and slight downward pressure or slight downward motion in your belly when you exhale. You can do diaphragmatic breathing either while you are seated or while you are standing. Important is that you have your shoulders relaxed. Do diaphragmatic breathing 4 times, repeat it 2 times a day. Now, if you notice difficulty with breathing or dyspnea, the best breathing technique that can help you is what we call as pursed lip breathing. With pursed lip breathing, you're still going to inhale slowly and deeply through your nose and exhale with your mouth. This time with your lips slightly pursed. It's as if you're blowing the flame of the candle. The purpose of pursed lip breathing is it will allow or open your airways longer, promoting better flow of oxygen. Do pursed lip breathing 4 times, repeat it 2 times a day. Next, we have what we call as controlled coughing. So with controlled coughing, it's the same. You're going to take deep and slow breaths through your nose, and then you exhale through your mouth, and then followed by a slow cough. The purpose of this is to mobilize and loosen sticky phlegm. Do controlled coughing 3 times only once a day so as not to irritate your throat as well. Next technique is what we call as huffing technique. So with huffing technique, you're going to inhale briefly through your nose and then you exhale with your mouth, and instead of coughing, you make the ha sound. So it will really stimulate coughing reflex in your throat. Do this 3 times once a day only to also prevent irritation. In the clinic, we also do what we call as postural drainage, wherein we use gravity to help patients clear mucus, depending on which lobe of the lung is affected. But since you need licensed physio to help you with that technique, what I will teach you is something that you can do on your own at home without the use of any equipment. What I will be teaching you next is chest mobility and stretching exercise, which will target your pectoralis muscle because your pecs are also your muscles of inspiration. To do chest mobility and stretching technique, you can do this either while you are seated or while you are standing. You clasp both hands together, put it behind your head, and then move your shoulders backwards while inhaling deeply. And this time, you put your elbows together while exhaling. You repeat this technique 3 to 4 times only once a day. The next effective technique that you can do to help loosen sticky phlegm is the percussion technique. So you don't need any equipment for this, you only need your hands. So with your hands, kind of form a letter C, like this. Percussion is not for you if there is rib fracture and if there is formation of a blood clot. One very important thing that you also need to remember to help remove sticky and stubborn phlegm is to keep yourself hydrated. Have a water bottle inside your room or an area where you can easily see it to remind yourself to keep yourself hydrated. Because once you are hydrated, your airways are moist and then you can easily cough out the phlegm. Before we continue about the position of comfort or the best position that you need to do if you have difficulty with breathing, at this point, I would like to please ask a favor from you. If you think practical health videos like this are helpful, to please take only 1 second of your time to please click the like button below. And if you haven't subscribed yet, don't forget to click the subscribe and the bell button below as well. If you have cough or phlegm, do you know that physical activity is good for you? Simple aerobic, even simple walking, it can really help remove mucus. Plus, what is good is it can generally improve the condition of your lung. As a rule of thumb, just don't exercise to the point of exhaustion. Now, moving on. What is the best position if you have difficulty with breathing? Simple. You sit down, you lean forward, and put your elbows on your thigh while doing pursed lip breathing, the one that I taught you a while ago, wherein you inhale through your nose and then you exhale with pursed lip as if you're blowing a candle. These are easy, effective breathing and coughing techniques that will greatly help remove sticky and stubborn phlegm in your throat and in the lung. This is best paired with the medications that had been given to you by your doctor. If you have reached the end of this video, please comment, breathe in the comment section below. I would really love to hear from you. And don't forget also to check out other helpful videos in our channel as well. Thank you very much for watching. This is again Doc Cherry. Stay safe, stay happy and healthy. God bless you.